Okay. Can you tell us your name and what you like? What is your position and what company you work for?
Sure. So my name is Monica Winston. I work for Gift of Life Michigan, and I am a hospital donation advocate. So I am the liaison between the hospital and Gift of Life.
Um, so what we're doing is an organ donation project, for like different like questions, and it's like just helping us choose if we want to be like an organ donor when we grow up. Okay. So, can you tell us what organ donation is?
So organ donation is when someone dies and gives the gift of one or more of their healthy organs to somebody who is in need of a transplant.
Okay. Um, so like, do you know any like frequently asked questions about organ donation?
Yeah. So a lot of times people ask if they can be an organ donor. A lot of times people think that they have different medical conditions that might rule them out. And so there's a lot of questions regarding that, especially when trying to figure out if they want to sign up on the donor registry. The nice thing about it is if an individual does choose to sign up on the donor registry, if um, if you were to pass away in that manner, then we would do all of that work to determine the potential prior to. So once you make that hard decision, we would be the ones who would be assessing that potential. I think that's one of the biggest questions. A lot of times people have questions about religion and if different religions are supportive of donation. That is a large question. All religions do see donation, which is of organ tissue and eye, as the ultimate act of human kindness and generosity. So that is one of the questions that we get a lot too. And yeah.
Okay, thank you. So can you tell us like some unique like facts about organ donation?
I can tell you some, yeah. So organ donation is very rare. Only 1 to 2% of people pass away in a manner that they can become an organ donor. In 2023, we had a record-breaking year for organ donation. There was 575 organs that were transplanted. Or sorry, there was 575 organ donors, and then there was just over 1,300 organs that were transplanted. And currently there are about 107,000 people that are waiting for a life-saving organ. And then 17 people will die today waiting for an organ. So the need is very, very great.
Okay. So what are some like myths about organ donation?
Sure. I think the biggest myth that I hear is that hospital staff might not save your life if you're an organ donor. So when the patient arrives to the hospital, their first priority is to save your life. And they both have the moral and legal obligation to their patients to provide the best possible care. And then when death is imminent and has been declared or discussed with the family about a grave prognosis, that's when we're typically contacted. So we're only contacted at that time. Okay. I think the biggest myth too is like we had already discussed too with the health problems, that certain health conditions can rule you out, and that's maybe why you wouldn't sign up. There's less and less medical rule outs for organ donation. So an HIV positive donor can donate to an HIV positive recipient, and then an individual with hepatitis can donate to a recipient that has or does not have hepatitis. Because there is treatment, we would always let the recipient know, and then they would get to choose if they wanted to accept the organ. So
Okay.
I think those are the two biggest ones.
So who can be an organ donor?
So anyone can be an organ donor, as well as a tissue or cornea donor. Like I was saying earlier, we will always assess the potential prior to having a conversation, but anyone could be a donor.
Okay. So who gets on the transplant list and like how do they get on it?
Yeah. So someone who is in need of an organ transplant is placed on the waiting list. They would meet with a team of doctors who then determine that the patient needs the transplant to survive. There's a couple different things. So they will look at each transplant center has their own criteria. And so that's kind of looked at too. And then that's where you would be listed at. And then you would need to live within a certain distance from the transplant center. Um, yeah.
Okay. Um, so what organs and tissues can be donated?
Sure. So there are 8 life-saving organs that can be donated. So your heart, your liver, lungs, kidneys, intestines, and your pancreas. And as far as tissue donation goes, your eyes or your corneas can be donated, bone, tendons, skin, heart valves, pericardium, veins, and nerves. And then there is also placenta donation as well recently.
So what is the most common organ to be donated?
Sure. So the kidney is the most common organ to be donated. It is also the most needed organ in the state of Michigan as well as nationally. And then currently in the state of Michigan, there's about 1,900 people that are currently waiting for a kidney.
Okay. How long are organs viable for?
So as far as the viability, it depends on the specific organ. Some organs can be out of the body for a longer period of time, such as the kidneys. They can be on perfusion pumps. Thanks to these different medical devices, it can keep them healthy for longer. But the goal of the organs is to transplant them as soon as possible, and it is usually within a couple hours.
Okay.
What is the difference between a living donor and a deceased donor?
A deceased donor has been declared deceased at the hospital from a cause that didn't damage some of their organs. This is usually a result of a cardiac arrest or a severe injury to their brain that causes your body to no longer work. As far as a living donor, this is typically a healthy individual. Typically, they're friends or relatives of a person who is in need of an organ. However, it's not always. And a living donor can donate one kidney or part of their liver, a lobe of their liver, which will grow back to full size. So the biggest difference, sorry, is the type of donation, right? So from a living donor, you couldn't donate your heart or your lungs or your pancreas or your intestine. So it would just be your kidney and part of your liver.
Who often serves as like a living donor? Who often serves as a living donor?
Typically, it would be a friend or a family member is the most common, but it could be anybody.
How are organs matched between a donor and a recipient?
So what happens if Gift of Life will always perform the necessary lab tests and submit them to the United Network of Organ Sharing, which is also known as UNOS. This is a national nonprofit organization, which is contracted by the federal government to match patients on the waiting list for organ donors. And then the potential matches are thoroughly evaluated with a lot of different factors that they consider. So they'll consider your blood type, your body size, how sick the patient is, that being the recipient, how long they've been on the waiting list, and then the timing to give the transplant a higher possible change of success.
What happens if a donor and a recipient are at different hospitals?
Yeah, so this happens really frequently. What happens is typically a transplant team will either fly or drive in to the donor hospital and recover the lungs or the heart or some of the different organs. And then we do also have local recovery here as well from Gift of Life that can recover as well for transplant teams.
What are like some steps of a deceased donation? Like,
kind of what's the process of how Gift of Life gets involved and then how the transplant occurs? Is that what you're asking? Yeah. Okay. So typically a patient is admitted to the hospital and they're given a medical diagnosis. When the patient meets a certain clinical triggers, they will give Gift of Life a call. And then we will determine if the patient has organ potential. We will then work with the hospital to and continue to follow the patient until it's appropriate to have a family discussion, if it ever becomes appropriate. With the family discussions, we always talk to the hospital staff before speaking to the family. We want to make sure that the family is understanding of the grave prognosis. Organ donation is always an end of life decision, so we never want to talk about this prior to that moment. Okay. We'll always talk to the family. And if we get authorization for donation, then they do a detailed medical social history. And then we'll start up the case. At that time, once we get all of that information, Gift of Life starts doing a medical evaluation with kind of that blood work and that testing. We do imaging to start working on matching or allocating the organs. And then typically donation takes time. It takes 48 to 72 hours of donor management prior to the recovery. But once we are ready and we've worked out a time with the family, the Gift of Life staff, and the operating room as well, then we'll do the surgical recovery or the procurement. And we'll use preservation, kind of talking about those pumps that I talked to help preserve the organs. And then we'll always transport those organs to the transplant center. That is where the transplantation of these organs occur. And then if the patient is if they're going to be a tissue donor as well, then Gift of Life would transfer that that patient to our donor care center in Ann Arbor for the recovery there.
How many lives can one organ and tissue donor help?
So one donor can save the lives of 8. So there's 8 life-saving organs, and then up to 75 lives can be improved from one donor for tissue donation.
What are some historical events that happen with organ donation?
So the first organ transplant was in 1954. This was a kidney transplant. Also in 2008, there was an act, we call it the UAGA, which is the Uniform Anatomical Gift Act. And this helps state uniformity among states with the federal regulations for organ donation. And then the most recent one was actually in 2023 in the state of Michigan. So the governor, Gretchen Whitmer, signed the Check Your Heart Act into law in July. And it was making Michigan the first state in the country to enable residents to add their names to the donor registry on their state income tax forms. So this year on your tax forms, there will be a question. I know you guys don't fill out your taxes, but you know, that will be on the tax form. So take a peek out for it.
What are 3 like websites or like stuff that help you to find out this organ donation if you're like new to organ?
Yeah, so I think the best website, which I always refer people to, is the Gift of Life website. This has a lot of information about different processes, Gift of Life, the support services that we offer. And so that would probably be the best one to check out. And that website would be, That one would be www.giftoflifemichigan.org. I think that would be the most reliable source.
And do you think like middle school students would be interested about becoming an organ donor?
Yeah, so I think as far as organ donation goes, it's everybody's individual choice. I think starting in middle school and having these conversations of if it's important to you with your loved one and your family who would make those decisions is the most important thing. And kind of discussing what your wishes are. And, you know, you won't be able to sign up until you get your driver's license at the Secretary of State. But I think starting those conversations early so your family does know what your wishes are is the most important thing. So I think at any age, this conversation is always good.
And I have a personal question. Like, so just say like I donated a kidney to like a loved one in my family. They needed one. Would I still be able to play sports and become an athlete, or would that affect my athlete life?
It depends on the sport. I don't know a ton of the logistics. That's a good question to ask. I think you might be limited on contact sport. Like you wouldn't be able to do contact sports. But for like if you donated a lobe of your liver, then the liver would grow back eventually. So that would kind of be a good question to ask your doctor. I think one thing that's really cool that I didn't mention is there is something called directed donation. And so if a individual passes away, we will always ask their family if they know anyone that is needing a life-saving organ. And we will always ask them what organ that individual needs, what their name is, what their birthday is, what transplant center that they are listed at. And if they are a perfect match for that organ, then they would receive that organ. So they would move up the list and then they would receive the organ. And then if it wasn't a perfect match, then they would just stay where they were on the list.
Okay. All right. Thank you.
Of course. Do you have any other questions for me?
No, that's
No.
it.
Okay. Well, if you need anything, you reach out to me, okay?
All right.
Okay.
Okay, have a good day.
Thank
You
you.
too.
You too.
Thanks, bye.
Bye.